Alicia, I'm your nurse practitioner today. We're going to do a head, eye, ear, nose, and throat exam, and then a cranial nerve exam. Okay? I'm going to start with your skin and note on your head, and note the color, which is fine, temperature, moisture, turgor. Look for scars. You do seem to have some scars here. Did you have acne as a kid? Lesions, navi, that all looks perfectly fine. Your head is midline, it's symmetrical, it is the appropriate size for your body. All good news. I'm going to palpate your scalp, if I may. I'm finding no lesions, the texture is fine, color is fine, I don't see any infestations of any kind. Good news. I'm also going to now inspect your eyes. Actually, before I finish, I'm sorry. Back up for just a second. I'm gonna go through your cervical, your lymph nodes. Okay, sorry. Test your temporal. Any tenderness there?
No.
No. Okay. Preauricular node, postauricular node, occipital node, tonsillar node, submandibular node. Submental node, I don't feel any inflammations, any sign of infection there. Anterior cervical, posterior cervical, supraclavicular, no problems there. I'm going to hold on to this mandibular joint here. Can you open your mouth for me and close it? It's a little subluxation over here, but I don't feel any crepitus. Is that painful at all? No. Can you push against my good, that's great. And then I'm going to feel your face for light sensation, if I may. Okay? Yep, close your eyes. And when I touch you, just say yes. Good, very good. And then I'm going to do your facial, test your facial nerve and your facial movements. Can you raise your eyebrows, please? Smile at me. Frown. Good. Puff your cheeks out. Good, very good. Make a pucker face. Very good. All right. And then just stick your tongue out at me. And that's midline. It looks perfectly fine. Good. I'm now going to move on to your eyes. I'm going to start with your eyebrows. I don't see any dryness or scaling of any kind. Your eyelashes look full and fine. I'm looking at your palpebral fissure, which looks normal. There's no entropion or extropion, no ptosis or drooping of your lid. I see no discharges in your lower lid. I'm just going to look at your inside your eye just a little bit for just a second. Just because the light's not very bright in here. I'm looking at your sclera, which is not yellow as a sign of jaundice. I'm not seeing any irritation or iritis or cloudiness as a sign of glaucoma. And now, since I'm right here, I'm going to cover this eye. If you could look at a point straight ahead, I'm just going to shine this light in your eye, okay? And see about a direct pupillary response, which you have. And then I'm going to do it again and look for a consensual response, which you have. And both eyes, please. All right, there, direct response, good, and consensual response, very good. Now we're going to test your actual eye movements. Could you cover this eye, please, and read the letters on that surface there?
DSCN3890.
Good. And can you cover the other eye and read those same letters backwards?
ANGISED.
Yes, good, very good. Now I'd like you to look at this pen. Focus on it there. Good. That's accommodation, and I'm going to just keep following it. I'm going to bring it in towards your nose, which will make your eyes cross a little. And good. That's accommodation and convergence. Now, if you could keep looking at this, I'm going to take it. Just keep looking at the pen. Keep looking at the pen. Good. I see no nystagmus. Your eyes are moving in a parallel way. Good. Very good. No shaking. No issues there. Can you go back to covering one eye for me?
Yep.
I'm going to cover the same eye, and I want you to tell me when you see my fingers appear in our peripheral vision.
Yep.
Good.
Yep.
Good.
Yep.
Good. And the other eye?
Yep.
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 Good.
Yep.
Good. And those match mine, so that's a good sign. I'm going to look at your ears now and look at the outside. They appear to be a good size. I don't see any obvious deformities, lumps, masses, or lesions of any kind. Your pinna appears smooth, no signs of carcinoma. If I pull a little, is there any tenderness there? No? Good. 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 I'm just going to look a little bit inside. Good. Little cerumen, but no obvious irritation. Good. Good. If I had an otoscope, I could look more carefully. Right now I'm just going to test your hearing. So to cover this ear, I'm going to whisper a number in this ear and you tell me what it is. Okay?
92.
Good. And the other ear?
27.
Good. All right, good. And just because we can, I'm going to do a quick test on conduction and sensory neural hearing loss. So tell me if you can hear this in both ears. Can you hear that? Can you hear that? Good. So that was a Weber test that shows you don't have any conduction hearing loss, and the Rene test that shows that you don't have any sensory neural hearing loss. Head, eyes, ears. Your nose is midline, deviates just a little bit. Any tenderness here?
No.
Nope. Any sinusitis?
No.
Not too bad? Okay. Can you plug one nose at a time and just show me you can breathe through it? Good. Good, good. Nasal patency. And I'm going to palpate your frontal sinus. Any tenderness there?
No.
And your maxillary sinus. Any tenderness there?
No.
Good. And now please open your mouth. Now look inside your mouth here. Good. Stick your tongue way out. You say ah.
Ah.
Good. And your uvula rises symmetrically, so that's cranial nerve 9 and 10 as well. Can you stick your tongue all the way out and let me look under it? Everything looks normal here. I don't see any exudate, any leukoplakia, any Koplik spots, which are white spots. Do you chew your cheeks?
Not really.
Did you bite it back there? It's a
Maybe.
little, yeah. Do you get canker sores? Do you have any aphthous ulcers?
Sometimes. Not
I
very
don't
often.
see any. Okay. All right. I'm just going to look around at your teeth for just a second. I don't see any tooth erosion. A little bit of gingivitis there. Does your dentist say so?
Mm-hmm.
Yeah, a little bit. Good, good. No tonsillitis. Your pharynx is good. No irritation there. Any trouble swallowing?
No.
No. Good. And then I'm going to just do this one more time. Pop your jaw all the way open. Yeah, good. And then I'm going to make sure that you have, we did your sensation here, didn't we already? Okay, and we did your facial movements, and then stick your tongue in at me one more time. Midline. Yeah, good. Okay, so that's it for the head, eye, ear, nose, and throat exam. If I had found something abnormal, let's say one pupil was dilated and the other was not, I could then proceed through a neurological exam, some of which we've covered. So if I were to test your olfactory nerve, which is your sense of smell, I could just say, have you had any trouble smelling?
No.
Can you taste your food? Okay, good. Your optical nerve, we actually did. We tested for your visual acuity when you read. I looked for your pupillary response. We also did your ocular motor nerve when we had you watch the pen from here to there and did the 6 fields of vision and did the finger test as well, actually the optical nerve. The extraocular movements covered the oculomotor and the abducens and the trochlear nerve. That would bring us to facial, which you also did when I asked you to raise and lower your eyebrows, smile and frown. We found no issues there. Vestibular cochlear we did by testing your hearing, the Weber and the Rene test. The vagus nerve we did when you said ah and your uvula rose symmetrically, which brings us down to accessory, right? Glossopharyngeal, that was also the ah. Hypoglossa would be for you to stick your tongue out, which we did, and the spinal accessory is for you to shrug your shoulders against my arms. Very good. The rest of the neuro exam involves your extremities. So first of all, if you just put your hands out here, close your eyes again and tell me when you feel me touch you. Just say the word yes when you feel me touch you. Good? Good, very good. Now I'm going to put an object in your hand. I want you to tell me what it is. Close your eyes.
Right.
What is that?
An eraser.
Okay, good. And what is that?
The battery.
Yes. Is that tricky?
I wasn't exactly sure.
Yeah. And then I'm going to test, that's something called stereognosis. I'm now going to test graphesthesia. I'm going to, close your eyes, I'm going to draw a number on the palm of your hand. I won't actually draw on you.
Yeah.
But tell me what number I am drawing, okay?
Okay. 3.
Good. And here?
7.
Yes, very good. Okay. Now to test your finger movements, can you go thumb to finger over and over again? Like this through all of them? All of your different fingers? That's good, good. And can you flip your hands over like this? Good, very good. And now facing me, I'd like you to first touch your nose and then touch the pen. And I'm going to move the pen around and keep touching it. Go, 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 go. Good. Can you do your other hand?
Yeah.
Go. Yeah. 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 Yeah.
That's harder than it looks.
Very good. Okay, I'm going to test some of your reflexes now. I apologize for my hammer, but I tested it on myself and it's just fine.
Yeah, that's fine.
All right, so first I'm going to test your brachioradialis. You've done this before, it works fine on me. You don't seem to get that much of a jump. Can you feel the jump?
Not really.
No, it's not. Are you relaxing your hand? Relax
I
your
think
hand.
so.
Relax your hand. Okay. I can do it on myself and it seems just fine. There.
I felt that one.
Oh, I
Yeah,
got that one.
I don't know what's going on over here
I
on
don't know
this
what's
side.
going on over here either. All right, so we'll make a note of it.
Left side doesn't seem to work.
Right.
Probably just wore out.
Here's your bicep tendon and your tricep tendon. And a little
Yeah.
jump there,
Yeah.
not much.
Yeah.
Good. This arm has some sort of diminished reflexes, though.
Maybe.
All right. Can you cross one leg over the other? We'll test your patellar reflex. And your Achilles reflex. And your Babinski reflex. I know, it's a little irritating, I'm sorry.
Funny sensation.
It is. Can you cross this leg and we'll do
Yep.
the other side?
Funny, I feel it.
You're not jumping much on this entire side. Just a little bit, but
Yeah,
it's not
just
giving a
little
nice
bit.
big
It's not-
visual
yeah,
kick.
no, it's not.
There you go.
That was a little
Alright.
more.
I can feel you going, but it doesn't make a very big response. Okay, and that was the Babinski reflex. I'm just going to make sure you have light touch sensation
Okay.
here like we did before.
Yep.
So you can feel that
Yep.
and that.
Yep. 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 Yep.
Good. And this side.
Yep. 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 Yep.
Good. Now, if you could zoom that camera out a little bit, please stand up for just a second.
Okay.
Look at me. And just close your eyes. Okay, you've maintained your balance. It's a Romberg test. That looks fine.
Cool.
Please walk in this direction and turn around and walk back again. Good. Can you do it again, going heel to toe as if you were on like a balance beam? Good. And back. Good. And then please just hop on one foot. Be careful that you don't fall. Good. And on the other foot. Okay. Thank you. Thanks for your cooperation.
Okay.
Thank you.